Visits during investigation, testing and the contact tracing. So we ask that you pause the visits, except for your compassionate care, the end of life, and your essential caregivers until that first round of testing is performed on the unit or facility-wide, if that's what you've chosen, the approach that you're going to use, and you get your results. If one unit is involved, pause units or visits, on that unit. You do not have to pause it for the entire building. Visitation. So after the visitation has been complete, resume, or the investigation, has been completed, resume your visitation for all residents, regardless of the vaccination status, unless they've been identified as a close contact or the resident is suspected or confirmed to have COVID. This includes all residents on the affected unit or throughout the facility. We're still hearing of buildings being put in lockdown, et cetera, and there really shouldn't be any reason for that to be occurring. So there are some visitation limitations that apply to certain residents, the suspected or confirmed. We're going to go through those, and those that are identified to be a close contact, and we'll go through that as well. If a resident is identified to be a close contact, it will be based upon the vaccination status as far as what they can and can't do related to the visit, and I'll share that on the next slide, I believe. If the resident is suspected or confirmed to have COVID, they may still have the compassionate care, end of life, and essential caregiver visits in their room. We ask that they not go outside. That's usually problematic just for getting them through hallways, etc. Okay, so these are residents identified as close contact. Is quarantine required? So when I said the statement about vaccination status and status entering into the decision, so we've tried to break this down for you. If it's somebody that's symptomatic, regardless of the vaccination, they're going to need to isolate using transmission-based precautions. They will be tested, and healthcare workers must wear the full PPE. You're going to treat these as people that are suspected to have COVID because they're symptomatic. If somebody is asymptomatic and fully vaccinated, there is no need to quarantine or restrict the resident to their room, but the resident should be wearing source control at least for 14 days post-exposure. Now, this is new. This is the new CDC guidance that came out on the 10th, and I'm sure you've all read that. So that's what this is, a summary of that statement from them. Again, yes, in Illinois, we already have the source control rule for anybody in long-term care, but this is the verbiage exactly from CDC as far as wearing it 14 days post-exposure. If it's an asymptomatic and they're unvaccinated, they do need to quarantine for the 14 days, even if they've tested negative, and the healthcare worker must wear full PPE. Always need to throw this in here just as a reminder, because I think we get so busy doing everything. Don't forget about the fact that if they've had COVID within the last 90 days, they don't need to quarantine, but they should still wear the source control. And if moderate to severely immunocompromised, you might want to consult, it's probably best to consult the resident's healthcare provider to determine if quarantine should be required or not, based upon that individual's health. Okay, so this is a little bit of going into more detail related to visitation, the dining, and the group activities for residents that have been in close contact. I know there's a lot of words on this page, and again, you'll have the slides available, and we'll go into this probably again next week just to reiterate some of these points. So visitation only related to residents identified as close contacts. Unvaccinated residents with close contacts, they're in quarantine. They're allowed indoor visits in their room only. Outdoor visits may be possible if the resident wears source control, maintains physical distancing, but they can't linger in the hallways. So they're going to go from their room to outdoors wearing the source control. If it's a vaccinated resident with a close contact, they can participate in indoor visits in their room, in the common areas that you've designated as the visitation space, if the resident and the visitor wear source control and physically distance. Now, again, Illinois, they're wearing it anyway, but this is, again, CDC verbiage here. Outdoor visits are allowed wearing source control, and that's because these individuals have had a close contact, and we're just going to watch them through that incubation period to make sure that they're not going to develop the virus. So in dining, unvaccinated who are in quarantine should not be participating in the communal dining, going to the main dining hall, etc. So they should be dining in their room. Those that are vaccinated may participate in communal dining, wearing source control to and from the dining hall, and wear it unless they're eating or drinking. Group activities, same thing. Unvaccinated should not be participating in the group activities because they're in quarantine. The vaccinated residents, remember, they're not being restricted to their room, so they could participate, but they have to have that source control on. New admissions, readmissions. Okay, so we talked a little bit about this last week, real basic, and I talked to you and I said something about we're going to be asking you to do some testing. We're sharing that testing with you today. So on new admissions, if on the quarantine component of it, unvaccinated residents are going to have to quarantine when you're admitting them, readmitting them. Vaccinated are not going to be required to quarantine, but we are asking that you test. When the community transmission levels are substantial or high, asymptomatic new admissions and readmissions, regardless of the vaccination status, must be tested on admission if not done in the past 72 hours. So if you're getting an admission from a hospital and they've done the test there within that time frame, you can do it. It's not required for them to do it though. So I don't want you to say you can't, we won't take them unless you have it done. We ask that if it isn't done, you perform the test. It just needs to be, we'll accept a test within the 72 hours of their admission or readmission date. And if that is negative, you're going to test with, again, 5 to 7 days after admission. If the community transmission is low to moderate, then you're not going to need to test. We're worried about that high, substantial to high community transmission levels. And you are going to love this. This is the slide I was excited to share with you. So residents that leave the building, there's been lots of discussion. What do we do? What do we do? How do we feel good about this? So instead of having the risk assessment, we've either got blanket statements of yes or no. We are pulling in the community transmission as a factor and a criteria to determine if it's necessary or not. And then when it gets to that substantial high, we're going to add that element of testing so that we can, instead of using the risk assessment, we're going to test. And if they've been out, you'll know if you can hopefully catch it early if they had been exposed when they were out of the building. So let's just break this down. We're going to talk about the quarantine, if it's required or not, or if testing is necessary. So the resident status is on your far left, the vaccination status, excuse me. So it's unvaccinated first, out less than 24 hours or greater than 24 hours, and then the vaccinated out for less than 24 or more than 24. And then is quarantine necessary? So as you can see, it is not required for any of them unless it's the unvaccinated and they are out for 24 hours or more. So any overnights, they're going to need to be placed into quarantine. Now let's go to the testing piece. So if it's low to moderate community transmission, no testing is going to be required. If it's substantial to high, none will be required for residents that are unvaccinated if they're for short outings. So the less than 24 hours, none. But if they're unvaccinated and they're out overnight, we're going to ask you to test them just like you do the readmissions. The vaccinated, same thing, because we're wanting to see, we're figuring our thought process is here is they're out overnight. We don't know what who they're with, what they're doing. If, were they at a large family gathering, et cetera. You don't know that about the other visitors that are coming into the building or to the event, et cetera. And so you're just trying to, you don't want that to come back into your building. So you're going to test so that you will be able to catch something early. And so that's the point of the testing, or the rationale for deciding to do testing. Just a reminder about the executive order requiring residents and visitors to wear source control while indoors.
Yes. Do we quarantine vaccinated residents who have had a close contact with a positive staff?
So on
No.
page 14 of the new, since we're talking about the new guidance, we might as
They
well.
don't have page 14, Deb.
I know they don't, but since we're talking about the new guidance, basically residents who've had close contact, if they're symptomatic, regardless of vaccination status, obviously you're going to isolate and test. But if they're asymptomatic and fully vaccinated, there's no need to quarantine or restrict a resident to their room, but they should wear source control for 14 days post-exposure.
So that's where I was said on that slide that you need to then get into the vaccination status of those. So you've identified the close contact. Now what? Well, then you need to subdivide, look again, are they vaccinated, unvaccinated, and go from there.
And then the next question, can all visitors now sit in common areas inside?
As long as there's appropriate social distancing and, between groups, between pods of people and appropriate source control.
Yeah, everybody has source control on, and you need to separate the groups. They should not be together, intermingling.